I've made no secret about all the work that I've put into trying to reach a bipartisan agreement on health care reform. Since the beginning of the year, I've led or participated in 59 meetings with senators about health care reform and 9 Finance Committee hearings and day-long discussions about health care. I've held 87 meetings with constituents about health care reform, and I've even given 10 speeches on the subject. This means long nights, early mornings, and working weekends. But all of this work underscores the importance of reforming the healthcare system. We need to reel in runaway costs of healthcare in order to make coverage more affordable and more accessible. The healthcare system makes up more than 17% of our entire economy. This is without question the only piece of legislation I've ever worked on, and maybe the only piece of legislation Congress has ever taken on that affects such a large percentage of our economy at 17%. It touches also the quality of life of every household the way few other issues do. With so much at stake, legislation this big should be based on broad consensus among members of Congress. A bill this sweeping should have the support of 80 senators. In the Finance Committee, we've worked to try to put together a bill that could garner this sort of support since the beginning of the year. We started with a blank sheet of paper, rolled up our sleeves, and approached bipartisanship as finding common ground. We're building from bottom up, and so far things in the Finance Committee have moved in a very bipartisan fashion. During this process, I've had the opportunity to speak with President Obama on several occasions. He has indicated that he would like health care reform to be a bipartisan effort. I hope he'll continue to push Congress in that direction and show leadership required, and that he can offer in a unique way to make sure consensus-building approach is used on an issue of this great magnitude.